session. Yeah, good morning. Please, if you join me, kindly drop your name and your location where you're watching from. If you're just joining me, kindly drop your location and where your location and your name. Your location and your name. Okay. You're welcome. All right. So if you're just joining me, you're welcome. I firstly we are to talk about the rules of diagnosis in chronic disease management in this life. Okay, so we're going to be looking at the functionality, the rules, and the the parts that the laboratory section of diseases. We are going to be outlining the chronic diseases and how the laboratory come in. Okay, how the laboratory come in. We're going to be doing that in few minutes. I don't intend to waste so much time on it. All right. So I firstly want to apologize for the unavoidable absence of my guest. She had an emergency, so she had to attend to it. So she may join us very soon. Okay. But for now, we have to go ahead with our, our lectures and what we need to know and learn today. All right. So I'm going to start by telling us the roles of laboratory scientists in the hospital. Okay. Yeah. So if you're just joining me, you can drop your name and your location. If you're just joining me, drop your name. We like I like I said before, if you're just joining me, please drop your location and your name. All right. If you're just joining me, drop your location and your name, and I hope you can hear me. I apologize before for the unavoidable absence of my guest. Yeah, she had an emergency and then she had to attend to it. All right. So talking about the rules of diagnosis in clinical management, firstly, let us know the role of medical laboratory in the hospital or in the clinic setting. Okay. Now, most people think that the clinic is just made up of doctors and nurses. So when you hear about the hospital, you hear about the clinic, you think, oh, it is just doctors and nurses that work in the hospital. And the hospital is just a bunch of different persons with different specialty that come together to deliver quality health services. Okay, so in the hospital, you have different departments that carry out their specific function to make sure that quality health care service is delivered to their patients. Okay, so the laboratory is one of the major arm of the hospital. The laboratory is one of the major arm of the hospital. They they carry out a very important function. I would say that the laboratory is the eye, it's actually the eye of the doctor. Okay, the laboratory is the eye of the doctor because whatever the whatever the doctor sees, he puts it in a test format for you to go and run. Now, when you go and run the test and the results comes out, it is with that result that the doctor can treat you. Okay, the doctor can only treat you with the result. The result gives an accurate diagnosis of what is wrong with you. Okay, so when the doctor consults you and um, sends you to run a test, he's just waiting patiently for the test to give him what exactly is wrong with you. Okay, so it is when they know what is wrong with you that you can be treated. Okay, so this is the role of laboratory in a clinical setting. In a clinical setting, so we have a lot of departments. We have the laboratory, which is basically what I'm going to be talking about today. We have the nurses, we have the radiologists, the radiographers, we have the phlebotomists. Even in the medical laboratory space, we have the phlebotomist, we have the microbiologist, we have different person. We have the paramedics, we have the emergency response team, we have all these factions in the hospital. They come together to make sure that quality healthcare services is being delivered to patients. Okay, so when you talk about the hospital, you're not just talking about the the doctors and the nurses only. Okay, the hospital has to do with a lot of persons with different specialties that come together to make sure that patients are given quality care, quality health care, and attention. Okay, so that is that. Now, based on my experience on based on my experience in working in the hospital, in the laboratory section of the hospital, I've come to discover that most people with chronic diseases, they pay more attention to their health. They pay more attention to their health. So why allow you to get to that stage before you begin to pay more attention to your health? So I've discovered that most people with chronic diseases pay more attention to their health. Okay, they pay more attention to their health, and then that is why you see them coming from time to time, to run tests, to make sure that their body is okay, that their system, that their health is in good state. Okay, so I would give a very good example that happens almost all the time, and that is diabetes. So in diabetes, you have a lot of them coming to check for their blood glucose level, fasting blood glucose level, and the random blood glucose level. They come from time to time to check these parameters to make sure that their 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 health is in good shape. Okay, so that is that. Now, how accurate diagnosis impacts chronic disease management? I'm going to be talking about how accurate diagnosis impacts chronic disease management. Now, accurate diagnosis in the medical laboratory setting cannot be overemphasized. Yeah, that's because it is actually the the next step to you getting well or to you getting better. Okay, so the more accurate your diagnosis is, the better for the medical doctor. If your diagnosis is accurate, the doctor will have little or no stress in treating the patient. But in a situation where the result of the diagnosis is not accurate, that is why you would have recurring sicknesses. When diagnosis is not accurate, the you have closed you have entirely removed the doctor's attention from what it should be, and that is because the doctor solely depends on the test result. Now, if the test result is not issued, it's a different thing, right? The doctor can just maybe go ahead to treat, but in a situation where you give the doctor a result, the doctor believes so much in that result. So it is even better that you don't give the doctor a result and the doctor goes ahead to treat you than giving him a false result or an inaccurate result, a result that is not true. That is not true. Okay, so the accuracy in diagnosis cannot be overemphasized. It is very, very important. The more accurate your diagnosis is, the closer you are to getting better. Okay, so that is it. So we're going to talk about some chronic diseases and how the laboratory help to manage these diseases. Now, the first I'm going to be talking about is cardiovascular diseases. Now, cardiovascular diseases are diseases that has to do with the heart, okay, the heart and associated blood vessels. All right. Now, the first I'm going to talk about is lipid profiling. Now, lipid profile is just a test that shows the amount of cholesterol, and triglyceride in your body. Okay. Now, this test is done by collecting your blood sample. When your blood sample is collected, the necessary things will be done and then separated, and then this test will be carried out. So lipid profiling is majorly for profiling the types of cholesterol and checking your cholesterol level. That's for lipid profiling. That has to do with cardiovascular diseases. All right. Now, we also have another one called the electrocardiogram. Now, in the electrocardiogram, it's called ECG, right? EKG, rather. Now, this is just knowing the electric signals of your heart. Okay, it is talking about the electric, like the name implies, electrocardiogram. It's talking about the electric signals of the heart. So this is one of the diagnosis that is carried out in the laboratory. Mind you, this is done using ultrasound scanning. Okay, so majorly this is for radiographers and radiologists. Okay, but it is still part of diagnosis process. Okay, still part of the diagnostic process. Okay, now another one is cardiac catheterization. Yes, cardiac catheterization is just about studying the different functions, the different parts of the heart and their functions. Okay, so it is still a diagnostic process that has to do with cardiovascular diseases. So when you are done with maybe a particular disease that has to do with your heart, this particular test can be carried out. Okay, so that is that. Then the next one I'm going to be looking at is diabetes. Now, this is very rampant. It is almost everywhere, and this increases with age, I guess. It increases with age because I've noticed that a lot of persons that suffer from diabetes are elderly. Okay, they are elderly. However, we also have young people that still suffer from this diabetes. Okay, now, so how does the laboratory come in managing diabetes? Firstly, there's what to call the fasting blood sugar, or fasting blood glucose test. Now, this is a test that shows the level of sugar, the level of glucose in your body. Okay, so when you are done with diabetes, you are likely to do this test over and over, in fact, every time. Okay, so this is a test that detects the level of glucose in your body, right? So we also have the OGTT, which is the oral glucose tolerance test. Now, this test is just done to know how your body can tolerate large amount of sugar. Okay, how your body can tolerate large amount of sugar. So this is a a a test for diabetes. Okay, we also have another one, the hemoglobin A1C test. Now it shows the level of glucose over the past 2 to 3 months. Okay, so the hemoglobin A13 test shows the level of sugar, the level of glucose from in the past 2 to 3 months. Okay, so there's like an accumulated portion, all right. Now, looking at another part, another disease that is very important, another chronic disease that's very important, we have the kidney, right? Kidney diseases. We have a lot of kidney diseases because the kidney plays very vital function in the body. Okay, it is one of the organ that works all the time, it is working. Okay, so the diagnosis that can be conducted, the tests that can be conducted by medical laboratory scientists in this regard is, we have what we call the EUCR. It's called electrolyte urea creatinine. Yeah, it's also called the serum creatinine test. All right, so this electrolyte urea creatinine, it checks the level of electrolyte, the level of urea and creatinine is associated with the kidney. All right, so this test is done by collecting the blood sample, and necessary separations will be done, and then the test will be carried out. So after the test, the result will be sent to the doctor, and the doctor will know what to do. So this is the role that medical laboratory scientists play in kidney diseases. Another one is the estimated glomerular filtrate rate. It is called the EGFR, estimated glomerular filtrate rate. Now, we know that in the kidney is majorly a filtration organ. Okay, it is responsible for filtering the blood. Okay, it's responsible for filtering the blood and converting it into the urine. Okay, so this particular test, it tests for the rate at which your kidney is able to filter, your blood. All right, so we have some people that has high rate of filtration, some also has very low rate of filtration. These conditions can lead to a lot of kidney problems or kidney diseases. Okay, for example, we have the diuresis. Diuresis, when your body is not able to absorb water, specifically at the proximal distal convoluted tubule, at the distal convoluted part of the nephron. Remember, the nephron is actually the the machinery for filtration. Okay, so the blood is filtered from the Bowman's capsule into the different segments of the nephron. Okay, and it goes and forms urine at the distal convoluted tubule. Now, at the distal convoluted tubule, that is where you have most of the absorption and secretion. So when your kidney is not able to absorb water, that means you'll be passing out a lot of water. You pass out a lot of water. Okay, so this test helps to checkmate the rates at which your kidney performs the filtration function. All right, so that is that. Then let's talk about the chronic obstructive pulmonary disease, COPD, chronic obstructive pulmonary disease. Now this has to do with the pulmonary system, the heart and the lungs. And one of the tests that is carried out in the laboratory is the spirometry. Is spirometry. Now spirometry is just lung function tests. Is the functionality of your lungs. That's spirometry. Okay, so another test that can be carried out to determine the chronic obstructive pulmonary disease is the chest X-ray, the X-ray of your chest. That is ultrasound, chest X-ray of your chest. I also have computed tomography. We also have computed tomography, that's CT scan, and so on. So these are tests that can actually detect chronic obstructive pulmonary diseases. All right. Now, looking at cancer, we can carry out what we call biopsy. Now, this biopsy is done with tissue sample, not blood sample this time, tissue samples. Okay, when these tissue samples are taken, this biopsy is carried out. We also have genetic testing and blood testing for cancer. Now, for viral diseases, this is where I'm going to end. For viral disease, we have a couple of ways we can detect viral diseases. One of which is the serology. Okay, so serology just has to do with using the serum to test for the presence of a particular strain of virus, okay, in the blood. So that is also a way that is used to determine viral diseases. And we also have the PCR, and the PCR is polymerase chain reaction. Okay, polymerase chain reaction. Okay. The PCR is polymerase chain reaction. Now, this is a particular test used to, it shows the molecular nature. It goes deep into molecules. So there's a particular maybe virus that's determined per se, that cannot be determined using maybe strips or other serological processes. You can go ahead to use polymerase chain reaction. It is a molecular method of determining the exact thing in a particular sample. Okay, we also have enzyme linked immunosorbent assay, ELISA. ELISA is also a method used to check the presence of a microbe or a microbe or a virus in a sample. Okay, that's immunosorbent linked immunosorbent assay. Okay, so the enzyme linked immunosorbent assay, rather, enzyme linked, like the name says, like the name implies, enzyme, it uses enzymes to determine what is in a sample. Okay, so that is the ELISA, enzyme linked immunosorbent assay. Now, to end it, I would like to talk about the challenges in diagnosis. Actually, the challenges in diagnosis: firstly, we have lack of machines in some labs. Some labs do not have the adequate machines to carry out these functions. Some labs do not have adequate machines to carry out these diagnoses. Okay, that's why most times we are being referred from one lab to the other to find out the particular lab that has the machine that can run a particular test. Okay, And secondly, is lack of power. Yeah, lack of power. Most of these machines, they require power. Okay, so when you are short of power, you may not be able to run a diagnostic center or a diagnostic hospital, especially in the region you find yourself. Thirdly, is operational manpower. A lot of labs do not have the manpower, the capacity of people that they need to run a particular test. They don't have. All right, so that is it. Now, another one is machinery illiteracy. The machines may be there, but you don't know how to use it. That's what we call machinery illiteracy. So the machines that are there supposed to be used, and then there is nobody that knows how to exactly use that machine. Okay, so that is what we call machine illiteracy, when there is no one that knows how to handle the machine, even though the machine is present, it's just be there. Okay, so that is a challenge in diagnosis. Now, next is cost of acquisition. The smaller laboratories, the upcoming laboratories do not actually have the manpower. Upcoming hospitals do not actually have what it takes. So that is that. Now, the last is cost of maintenance. Yeah, even though you have this machine and you know how to use it, and you have people that know how to use this machine, the cost of maintaining the machine alone can be something else. Maintaining the machine is very high. Most of the machine, because of maintaining the machines, you have to use some things, reagents, chemicals, and so on to run the machine. So the cost of maintenance, having to service the machine time after time, is a big challenge. It's a big challenge in the diagnostic practice. So these are the challenges in the diagnostic practice. Now, first, I want to finally and again apologize for unavailability. It is unavoided absence of my guest. She was supposed to be here with me, but she had an emergency which she had to attend to. Okay, so I promise that my next live, my guest will be seated here with me and discussing salient issues. Okay, so thank you for joining. Thank you. See you in my next live. And if you haven't subscribed to my YouTube channel yet, please do so. So you can get notifications when I drop videos, okay, and when I come on live. Thank you.